Patient-centric award, which our company is very pleased with. It shows the work that we're doing really is focused on the most important thing, which is the patient. That's why we have scientists in laboratories, why we have commercial people working on how to get medicines to the patients at the right time, why we have operations all throughout Europe. It's all about get a medicine that makes a difference to a patient, and delighted that's been recognised tonight.
Is it a revolution in terms of how you strategize, how you manage your company?
Well, our company is very clear in its strategy. 80% or more of our pipeline is a personalised medicine of one sort or another. It is the future. The days of the big blockbuster drug are gone. Now we have to work out how to get a range of different medicines to different patients that meet their individual needs. That involves a shake-up of the healthcare system. We need healthcare systems that can, first of all, find the patients, stratify them, diagnose them at the right point in the treatment pathway, and get them access to the medicines and therapies that they need.
That all sounds wonderful, but a big concern in Europe, and you highlighted the Europe and the European Alliance, is cost. Government is trying to keep its costs to a minimum. Are these treatments going to be too expensive?
Well, cost is absolutely a right thing for governments to look at, but what they really need to look at is value, and they have to start thinking holistically about cost. So putting money, investing money in the right medicine at the right time can save money. You don't want the wastage of a medicine that isn't of any use at all being given to a patient, may even be causing some harm, and nor do you want patients to not be able to go back to work, pay their taxes, be fit and healthy. So it's all about getting the patient at the right time, finding innovative ways where we can actually afford to pay them for, reward for innovation, and that's something that can be looked at the European Union level, as indeed is happening this week when the ministers meet in Malta.
We heard the British minister say there a moment ago how the UK wants to remain within the EU, that it's still within Europe. How important is the EU in developing this particular type of approach?
Well, we need to now we can't be isolated anymore. We look at Europe as an entity, we look at the world. AstraZeneca is a global company, we operate all around the world. But the fundamental thing about Europe is it has got the European Union. AstraZeneca is a Swedish UK company. We have massive operations throughout Europe. We're not letting Europe go. If anything, we're focusing even more on what the EU 27 will do as the UK negotiates its exit. We want to remain, though, as the UK, very firmly involved with the policy environment in Europe, with the exchange of research environment, with the whole ecosystem that makes Europe a good place to do the type of work we do. Because if we don't do it in Europe, other parts of the world certainly will.